Dr. Russell Samson joins us today to talk about unsightly hand veins. Welcome back, Doctor.
Thank you.
Okay, hand veins. We all have them. Some have larger veins than others. What causes them and why? Why do we get them?
Well, most of what I've been talking about in these segments have been about diseases. This is not a disease. I'm sure people would hope that it's a disease, but it isn't. But you know, your hands are usually in a dependent position your whole life. They're hanging by your side. And the weight of blood and gravity makes them start to get bigger and distend them. And over time, it's a natural progression that the veins on your hands are just going to start getting bigger and bigger. And they become unsightly. I mean, it's just a matter of time that they are. So men usually don't mind it. But I think women, when they get a little bit older, don't like the look of their
Right.
their
We just
veins
spell
on their
vein
hands.
differently.
Yeah, that's it correctly.
So what can we do with them? What are the treatments?
Well, it's not really a treatment, but it is something that we can get rid of them. So I use the word treatment for something that's an illness, but we can certainly make them look better. So what we've developed, and I think I'm one of the few people around in the world that does this at this stage, we make tiny incisions under local anesthetic in the office. So first of all, we put a little bit of local anesthetic into the fingers, and it sounds uncomfortable, but the local anesthetic travels up the vein. So all I have to do is put a little injection into the fingers round about the knuckles, and the local anesthetic travels up, and then I can inject above in the hand, and the top of the hand turns numb.
Okay.
And then using a tiny scalpel, it's the same type of scalpel that we use to make an incision in the eye. That's how tiny it is. Make a little tiny incision over the vein. And interestingly enough, the vein has got no pain fibers. So when I touch or grab or squeeze a vein, the vein doesn't feel a thing.
No, you don't feel it.
Don't feel a thing.
No.
And so I can actually grab it with a specially designed hook, and through these tiny incisions, take the veins out.
Now, are they filled with blood? I'm just curious.
They're filled with blood.
Okay.
But you know, if you put your hand up like this, the blood empties right out. So we do it on a table. Basically, there's no blood in the hand when we take it out. Patient loses maybe a teaspoon of blood. So a lot of people say to me, well, what happens if you take the veins out of my hand? Won't my hand get swollen?
Right.
Or, you know,
or will you lose feeling in your hand?
So well, if I do something wrong, you'll lose feeling. But fortunately, I haven't done that yet. But there are little nerves around there which I can inadvertently grab, and that would make a problem. But there's no real blood loss with this. And the incisions are so small, we don't even put in a stitch, just a little steri-strip. And actually, we control the bleeding by putting on a nice tight glove. So whoever has this done has to wear a glove for about a week. But they have full function. They can drive and take care of themselves. They just can't take it off to shower.
Okay. Now, so when it's done, are the veins completely gone? Your hand goes back to being a flat surface again?
So there are two good things that happen to the woman's hand. Usually I say woman because that's who it is, as from this procedure. Because as you age, you also start to lose tissue between the tendons. So the hand tends to lose like it's lost fat on the top of the hand. So that also makes it look older. So there is a little bit of swelling that happens after this operation that fills that out. So not only do you get rid of the veins, but you rejuvenate the look of the hand because it looks a little bit more swollen on the top. So it's not swollen, it just looks more healthy. So I know some people have used like fillers that you use on the face to inject into it, but that's pretty ugly, and it doesn't. You have to do it frequently. This is a great procedure, and I have never seen a really swollen hand after this procedure because all the veins on the bottom are still there. We leave all of those behind. So a very nice cosmetic procedure, and it rejuvenates somebody because I think a lot of women who have had facelifts, they can come into my office and I say, well, you look much younger than your chronological years, and then I look at the hand and I immediately know how old they are. And you can take years off a woman's look by improving the cosmetics of the hand.
Now there's another procedure that you also do for hand veins. Can you tell me what that is?
Well, also for brown stains,
Yeah.
as the hands start to age and they get these brown marks on them, we
Yeah.
have light machines that can get rid of that.
Okay.
But generally, that's what it is. There are people that inject the hands with substances that kind of glue up the veins, but it can leave very bad brown marks. So in and it can leave you with some discomfort too. This treatment that we have is pretty revolutionary because the veins don't come back. And you
Right.
get a long-lasting, successful look.
Okay. Well, that's nice to know because, as we know, a lot of other procedures you have to have them done multiple times.
Multiple times, yeah.
But
And
there was something else. So we mentioned briefly a stab avulsion.
stab avulsion. Well, that's the
Yes.
term we use for the small incisions. Because if I told people they were going to have a stab avulsion, I think most of them would be revolted.
They wouldn't
and
come
never
in.
come near us. So we have
Okay.
a much better term. We call it micro-incision surgery or microphlebectomy.
Okay. Yes, that makes it sound
Much better term,
yes,
right?
Yes.
And it really works quite well. And it's not really, I don't think it's an expensive procedure. If you think a facelift can be $8,000, $10,000, $15,000,
Yes,
we
absolutely.
charge $2,000 for a hand.
Okay.
And go back to normal activity right away with hands that make you look a lot younger.
There any potential problems?
You know, theoretically, you're not going to be able to use your hand for an intravenous because they're not going to have any hand veins, but you've still got all the arm veins
Absolutely.
behind. You know, potentially, theoretically, there can be swelling, but I've never really seen it. And as you mentioned, I can inadvertently nick a nerve because the nerves run right next to the veins, so that can cause numbness in the fingers. I did have one woman who temporarily had some numbness in a finger, but that disappeared.
Okay.
So far, other than maybe seeing the little scars, which usually disappear, I haven't seen much as a potential problem.
Now, because you've said this is basically cosmetic, does insurance cover this for
Not-
any reason?
Not
Not
at
at
all.
all.
Not at all.
Okay.
It's purely something for cosmetic purposes.
Okay.
Make yourself look younger. You don't need it.
Oh, aren't
You look so young
sweet?
as it is.
Well, I won't show you my hands. Thank you, doctor. It's nice having you again.
Thank you.
And we always like to end with your
Well, this
website.
one was veinsandarteries.com or sarasotaveindoctor.com.
Okay. Thank you, doctor.
Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break.